Today on the Pro Talk podcast, we're having a conversation that everybody needs to listen to. Why? Because we're talking about the largest organ in the human body. But before we meet today's guest, make sure you push the subscription button as well as the notification bell so you never miss an episode of the Pro Talk podcast with another amazing professional. Well, today's guest, I've known him since I was a little kid growing up in Western Pennsylvania. We're both Minnesota Vikings fans. That's why I'm wearing my purple today, which I'm not sure why we are Minnesota Vikings fans growing up in Western Pennsylvania, but it was kind of painful, I guess, in Steeler country. But anyway, I want to welcome Dr. Patrick Shannon, dermatologist, longtime friend of mine. Welcome to the Pro Talk podcast, Doc. How are you?
Rob, great. Thanks for having me today.
Well, we're in for a treat because there's so much of the discussion today you hear on the news and the commercials is about skincare and skin cancer. I hear about it. Let me give everybody, the folks, a little rundown. Your qualifications. As I mentioned, you're a dermatologist. Your undergraduate degree is from Westminster College. You graduated Northeastern Ohio University College of Medicine. Your internships in internal medicine and dermatology residency at the University of Florida. You were a member of the American Academy of Dermatology and certified in Mohs surgery. You graduated honors in biology, and you were recognized with membership in the Alpha Omega Alpha Medical Society. 1991, Dr. Shannon received an Excellence in Anatomy Award. So, Dr. Shannon, dermatologist, sunscreens real quick. I see a lot of people that I teach tennis pulling out the spray sunscreen. Do those spray sunscreens work as well as putting on the lotion sunscreens?
They do, as long as you apply them correctly. The challenge with the spray is it's hard to tell, where the sunscreen has been applied and where it hasn't been applied. But if you do it correctly, you'll get the same SPF as the cream.
Okay. Well, that's good to hear. I see people and they're dancing around and it's this big cloud of stuff. And I've not said anything to anybody because I just wonder if it's getting on them the way it should. And
Yeah.
I guess I'm old school rubbing it in and so forth.
Yeah. Now that's the $1,000,000 question: is in that cloud, did you get it where you need it? And how close are you to the number on the bottle? Those are always the variables.
Yeah. What's your preference to use?
Personally, I like the gels. I think they rub in pretty well. I think they're easy to apply. They're not sticky typically. You can get a good SPF, and it's just some of it's personal preference. I heard one of my mentors, when he was asked the question about what the best sunscreen available is, his answer was the one the patient is willing to use. So, if you prefer the cream, you prefer the spray. If I can convince you that this is the best product on the market, but you hate it, you'll never use it, so you'll never get any value out of it.
That makes a lot of sense. Yeah. Well, I remember when we were kids, it was like you never heard the word sunscreen and you would get burned and then your mom would put on Noxzema.
Right. Yeah. Exactly. Or a lot of people would try to get that burn, early in the season, and then they would tan the rest of the year and figure they were okay. Unfortunately, that cumulative damage still continues, and you get into trouble later in life.
Now, is it true that we get most of our damage to our skin before age 18?
Yeah, it depends, I think, on lifestyle. When we were young, we were outside a lot in those ages. Today that's not necessarily the case. And if people have outdoor jobs or just a lot of grass to mow or golfers, I mean, they can get a fair amount over the next few decades too. So, yeah, I mean, earlier you can have a good lifestyle and protection. Certainly, there's value in that. I think a lot of parents are better at sunscreen on their kids than they ever were when we were growing up. But
Hmm.
it's just a day by day, hour by hour risk.
So I mentioned that you and I both grew up in Western Pennsylvania. Do you remember putting sunscreen on as a kid?
No. No, it wasn't very well publicized. Probably till, I would say, the middle to late '80s is when people started to be a little bit more aware of it, and it's gotten better over the recent years. But certainly in our growing up years, it wasn't commonly used.
Yeah. I remember my brother, he played baseball and he would always get the gap between his tube sock and his shorts and standing out in the outfield or infield, the back of his legs would just get roasted, man. Just come home all red.
Yeah, certainly as fair as Rick is, that's yeah,
Yeah.
no doubt. He didn't have much natural protection either.
What's that mean, natural protection? Like a darker skinned is better?
Yeah, darker skin has just more natural protection. The African American has a whole lot lower skin cancer risk than you or me.
Okay. That's one of my questions for later. So the fair skinned person is in more danger then.
Yeah, the redhead, the platinum blonde, somebody that has very little pigment has very little natural protection.
Yeah.
Yeah, just along that line, Rob, just the tan actually is the body's defense mechanism against UV damage. We tend to think about it in society as being attractive, but actually it's the body protecting itself against ultraviolet light damage.
Well, that's interesting. Very cool. So you said that you didn't put on sunscreen growing up. What sports did you play growing up? You probably shagging baseballs with your shirt off?
Yeah, many days. Yeah, we played, and then yeah, so baseball growing up, basketball growing up. Think about the outdoor games that we were shirts and skins, right?
Right?
So basketball, and then football. We did have more coverage, of course, with the protection and the pads and such. But yeah, those were my three sports growing up: baseball, basketball, football, depending on the season of the year.
So let me ask, going back in, did you play for Pulaski? That was the small town you were in, even though we were right next door to each other?
Yeah, yeah, Pulaski. Sure enough, we were there from. I guess started farm league baseball somewhere around 7 or 8 years old through 12, and then we moved up into the pony league in junior high, and then high school and American Legion baseball in high school.
Yeah. So in your sports background, who was your biggest mentor? Was it a coach, a teacher?
Yeah, I think, boy, I'll look at football here mostly because I got the privilege to play for two legends. So I got the privilege to play for Terry Varelli at Wilmington, and then Joe Fusco at Westminster College. I mean, two giants really in their own right, and just had a lot of influence on me over the years.
Now, who was your toughest teacher or coach? Was it Coach Varelli?
Yeah, I don't know. I guess he was. I mean, they were both, old school, very, very high disciplined, you know, uh, people who were not afraid to tell you what they thought. I always remember Coach Fusco early on in my freshman year. He introduced me to a new form of government that I never heard of before. He said, "I just want you guys to understand the form of government we have here on this team." He said, "It's a participatory dictatorship." And I didn't know what he meant by that. Then he clarified. He said, "I dictate, you participate. That's how we work this, right? This is not. We're not going to vote here. There is only one vote that's going to be counted. So, but that led us to hard work, discipline, teamwork, all the things. Avoiding bad habits, correcting errors, and the goal was excellence at the end, right?
Right.
That's what he was striving for.
Well, I'll get to it right now because you have a quote that I'm going to read talking about your time at Westminster and growing up as a kid. And what I know about Westminster, it seemed to me, my dad was the dean there for people that don't know, and we were always around the Titan athletic department as he did the PA, for the football team and the basketball team. So we were, college brats running around it. It seemed like Westminster won at just about everything. The swimming, the wrestling, it just baseball, basketball, and the football was winning several national championships when we were there. But here's a quote that you talked about Westminster. You said, "During my time at Westminster, I learned the value of preparation, hard work, and expecting that those things would lead to success. We were given an incredible gift, one that I didn't understand until many years later." So that's what you're talking about, the culture of winning and all the things you learned.
Oh my gosh. Yeah, just like you said, it's preparation. So when I was at Westminster, so I was an outside linebacker during the time I was there. My coach and still very good friend, Dart Huey was the main influence, I think, in my position group for sure. And we did something then that I never was familiar with. I'm not sure I've heard of it any other circumstance, but we did something called pre-practice practice. We would go out to practice to the practice field about 45 minutes before practice started so we could be prepared for practice when it actually happened. So we made the most of our time out there because we kind of got a lot of the, I don't know, misreps out of the way before we actually were practicing for the day. So preparation was one of those lessons that I learned there, and continue to practice that throughout my life. There's no substitute for preparation, no matter what you're doing, right? What you're doing here, Rob, for me in the office, and if I prepare well, that's a lot of the key to success, right? Because failing to prepare is preparing to fail, right?
Yeah. Yeah. How great is that? That's awesome. And I think of Derek Jeter when they asked him about how he performed so well in the big games, and he said he was always prepared. He never wanted to feel like he wasn't prepared. As you mentioned, and you guys at Westminster College, you won the national championship in 1988 and 1989. Is that correct?
Yes, that's correct.
Now, there's a story. I know a little bit about this, and I was telling my wife and daughter before we got on air that the MCAT is what, the entrance exam to medical school?
Yes, right. Hmm.
And is that a pass fail? Is that the way that works?
No, it's actually scored. Yeah, there's a score you get with grading it.
So you have to do well, correct?
Yeah, to get accepted, you do. Yes.
So I'm building it up. There's a little pressure involved with this test. Was it 80? I never took it. Um,
You're right. You're right, Rob. Yes.
so there's pressure, big time test, a little bit different than the ACT or SAT. But was it 88 or 89? Now, you and the quarterback, Joe McKeah, is that the way you pronounce his name?
Yes. Right.
Could you tell the story correctly? I don't want to guess about when you took the MCAT in relation to the national championship.
Hmm. Yeah, it's a good story. So this is 1989. So Joe went on to become a physician as well, and so they gave the MCAT one Saturday in the fall in our region. Well, that Saturday happened to be the day that we're playing football at Findlay University. So that there was a conflict in time between the MCAT and our football game. So we were able to find out that they would give an alternative test on Sunday morning the very next day. So Joe and I played the game at Findlay, won the game at Findlay, and then Saturday morning about 8 o'clock, whatever it was, we're sitting in a classroom at Oberlin University. I think there were about six of us in this little classroom taking the MCAT exam on that Sunday morning. So probably not ideal conditions for test preparation. Yeah, how you feel on a Sunday morning after a very physical game at Finley. At least I was pretty well beat up. I don't know how Joe felt, but probably not much better than me. We were tired, we were beat up, but there we were, 8 o'clock in the morning, taking the one of the biggest tests of our lives, quite honestly. So yeah, that was interesting.
So you're banged up, and I know you're not a partier, but still, I can't imagine getting a great night's sleep after being that adrenaline of becoming a national champion back to back.
Yeah, well, actually, it wasn't a national championship game, but it was a regular season game sometime
Okay.
that year. But still, yeah, it was. We played the whole time. It wasn't a blowout, so we played all four quarters, and
Okay.
it was, yeah. You felt a little bit beaten up, but that's part of one of the lessons in sports, right? Is
Yeah.
overcoming adversity, right? It's one of the other, I think, gifts that we get as athletes. Somebody explained it to me one time. The advantage of being an athlete is you get to deal with artificial adversity over and over again. And in learning how to deal with what they would call artificial adversity, when you actually get to deal with adversity in life, which we all do, you'll have a little bit of experience. So let me define, what do I mean by artificial adversity. So I covering the tight end and he beats me for a touchdown. Okay, that's adversity. I lose that one, right? But I got to line up against him. The next possession, it's the same thing. So you got to overcome that, forget that, get ready to line up and do it again, right? So when you get into life and real problems arise, you've had at least some adversity to understand it.
That's great. And so Dar Huey, was the expert in preparation. And I want to go back to in high school, you and your brother Brian. Your brother Brian's a year or year and a half younger than you.
Yeah, about a year.
Okay. You guys dominated so much of your high school sports that a Pittsburgh radio station came and can you I know you're modest, but can you tell us about that? That the Pittsburgh was it radio or TV program came to talk to you guys or honor you guys?
Yeah. Yeah, it was Post Gazette. There was a award that we were able to win. It was called the Extra Effort Award, did the KDKA. And yeah, that was my senior year and we were nominated for that. And a guy named, what was his name? Cutler, I think was his name, came up to the high school and there was an assembly and he interviewed us. It was fun. It was just a neat thing to do. And to be, to be there with Brian together, it made it even.
Mhm. So your parents, I've known them, they're just wonderful people, your mom and your dad, growing up. They obviously supported your sports and your sister is a bright girl also. And she's a physician's assistant, is that correct?
She's a nurse practitioner.
Okay. So Brian's a surgeon, orthopedic surgeon, you're a dermatologist, and Amy. What were some of the lessons that mom and dad taught you guys? I guess grades were a priority.
Yeah, grades were a priority. You finish things that you start. You don't complain about stuff. Attendance is assumed that you will be there. I learned again looking back on this. One of the lessons in my life. My mom was a school nurse, so there was no point in trying to be sick at home because you can't stay home anyway. So you don't miss a day of school from seventh grade on because mom says, you know what, you'll be fine. Just go. You'll feel better as you get there. And so you learn, the value of attendance and not making excuses and continue to work and treat people well and be kind and all those things. So yeah, lessons that we learned from a very early age.
Yeah. It's a testament to your parents, and that's true. And I remember hanging out with the Shannon boys, my brother and I, and you and your brother, and then our sisters were playing together too. So Brian goes on and plays football at Notre Dame. I don't know the exact number, but you guys were written up in an article that I think Notre Dame had won 23 consecutive games and Westminster had won 24. So you guys were sharing like the longest winning streak in college football at the time. And did they beat Miami that weekend and or did they lose and their streak get snapped? Do you remember?
Now they in 88 they continued on. They didn't finish 89 undefeated. I think they did lose in the bowl game. Yeah, we the Westminster so in that era we had the longest winning streak in college football at that point. It was 27 games. 1988 and 89 undefeated.
Nice. You ever wear your rings?
Once in a while, yeah, I have them, and I every once in a great while, if there's some event where people would know what they were, I have them every once in a while to wear.
Yeah. That's awesome. Let me go back. Part of this, what made me want to create the Pro Talk podcast, I see so many things happening in youth sports these days, and it seems like kids might not be as tough, or maybe we've made things easier for kids. And this participation trophy culture, it drives me nuts. Do you remember in the Wilmington Athletic League or Pulaski or Wilmington area, did you ever get a trophy for anything besides first or second place?
No, there was no such thing.
Okay. Did it bother you or did you just work harder?
No, I mean, a trophy was supposed to mean something, right? If you had it, you knew that you earned it, and it actually had significance. I mean, to get one for just being on in the group, I don't know why you would put it on your mantle. What's the significance of that?
Yeah, it's a good point. How did you were you a pre-med or a biology major at Westminster?
Biology.
Now, how tough was that being a real legitimate student athlete? Because I know Westminster is a tough school.
Yeah, it was challenging, no doubt. Absolutely. But one of the things about being an athlete there is that you actually were a student athlete. The academics were put in priority over football. Even during football season, as a science major, I had two labs that sort of coincided with practice, and there was not even a question. You were going to the lab instead of practice, and so
Hmm.
Joe McKee, the All-American quarterback, he had the same thing as me. There were 2 days out of the week he was in the lab instead of on the field.
Right.
So you think about that. The All-American quarterback, Joe McKee, had never lost a game in which he took a snap at Westminster. During the season, he's in the lab instead of practicing.
Wow.
I don't think that happens today very much.
Wow. They'd be changing the lab, right?
Exactly. Yeah.
Or they might say no lab in the fall because we don't want to stress out the quarterback.
Yeah.
Yeah.
We'll dub you up in the spring, right? So,
Good
yeah.
grief. Wow. Well, there's that culture of winning again. So he never lost a game at Westminster that he took a snap,
That he took a snap. Westminster never lost a game in which he took a snap. That's an unequaled record, right?
right? And then
Can't beat that.
he was quarterback for 2 years. Is that right?
He was. And some of his sophomore years, well, he played in a few games that year also. Yeah.
Yeah. That's amazing. Now, how many, let's see, they won three in the 70s.
Yeah. They won 70, 76, 77, and then 88, 89, and 94.
Oh, in 94. Okay. Man. Now you go back for any reunions?
I go back every once in a while. Yeah, I'll go back to a game in the fall, and so there have been reunions of some of those teams over the years. That's fun to see everybody.
Yeah.
Always.
Wow, that's awesome. What a great place. All right. I need to ask you, people are probably saying, wait, I thought this guy was a dermatologist, not a pro football player, but it's all part of the story. And when people meet you, does this happen to you? Like you and your wife are going into a restaurant, small talking with somebody, they hear you're a dermatologist. So they say, hey, what is this? Or can you tell me what this is?
Rob, it happens to me all the time, and I get pictures sent to my phone on a regular basis, and sometimes the pictures get sent to my phone. I think, I can't believe you sent that to me by text. That's crazy. But yeah, I get all kinds of those. That's okay. I enjoy doing it. It's not a burden to me at all.
Okay. Well, I haven't sent you one in a couple of years. I'm
That's all
guilty
right.
of that. Like, so,
No, it's okay. I don't mind it.
so you need to start playing tennis and send me a video of your serve. What do you think of this? Be glad to help.
Yeah.
Okay, so we mentioned at the beginning that you're a certified in Mohs surgery, Mohs. I hear that all the time, and I've got people that will come to the courts and they've got bandages on, and I had Mohs surgery. Can you tell us what is that, and why does it seem to be so prevalent, or is it?
Yeah, no, it's actually very common. So Mohs surgery is named after the man who started the procedure, a German surgeon named Frederick Mohs. I think back in the late 50s is when he designed the technique, and it's basically designed as a surgical technique to treat skin cancers. And the advantages of it are two things. One is the highest cure rate available, which is in about 98 to 99% for most skin cancers, and also allows you to spare tissue as well, because a lot of times we're working on the head and neck, and we're trying to take the smallest piece of tissue that we can. So the way we do this, and I'll do 11 of these tomorrow. We will have patient come in. All the spots that have been previously biopsied. We'll numb up the spot. We'll take out the scabby area that's there. We'll process the tissue and stain it, and then I look at it under the microscope right away. So we're able to take it off the patient and look at it under the microscope, usually within about 20 minutes. And then if the cancer is completely removed, usually we'll put some stitches in and send the patient home. If the cancer is not completely removed, we'll do this process again. So it all happens in the same session, but that way the patient is cancer free when they walk out of the office.
So it's slightly invasive, not terrible.
It is. It is. And certainly, the bigger the cancer, the more invasive it would be. But at least where I am, most of them are, on the smaller side, which is good. We try to get these as early as we can.
Yeah. So is there more skin cancer down here in the South where I live, or up north? Or does
Oh no, there's no doubt you have more than us. Yeah. Especially your guys that are outside playing tennis all the time.
part of my morning ritual, though. Yeah, so okay. Speaking of sunscreen, back to that. Okay. Is there really a difference between 15 SPF, 30, 50? I noticed that the thicker it is, or 50 and the higher numbers are just thicker and harder to put on. Uh, Is this, Madison Avenue marketing, or is there really a difference?
Uh, I'm going to try to give you the short answer to this one. This is a soapbox topic of mine, honestly. So basically, um, if you use as much as they used in the testing of these sunscreens, you would only need 15. Okay, essentially, you would have about 1 ounce of sunscreen per application would get you to the number on the bottle. Okay, but the reality is almost nobody uses enough. In fact, most people don't even use half as much as they used in the test subjects. So here's the real world situation: 15 is in reality probably 5, 50 is probably 15. So the value of the higher numbers is it allows for the person to basically use less and still get the desired amount. Like 15 blocks about 97% of all UV rays. That's all we need, really. But you'll never get 15 if you use 15. Do you follow that?
Yeah. Okay. So I use 30 just because of the consistency. I'm thinking, well, this is pretty good. It's 30. I feel like 15 is kind of watery, and 50 or 45 just like too thick.
Yeah. Yeah, maybe that you just need a different vehicle, something like a gel versus a cream or something like that, and you can get a little bit of a higher number. There are some fees actually that are not that heavy that might even be better, and I can give you that info later. But yeah, it's I think especially with what you do, Rob, where you live, higher is better.
Yeah. I don't even know what gels are. That's how ignorant I am with it. I just use the basic, 30 lotion. So gels, I'll have to check that out.
Yeah, they come gels, lotions, sprays, all kinds of stuff. So I'll get you that info so you're ready to go.
Is there a difference between brands?
I mean, in terms of the coverage, not really. I mean, some of it probably comes down to texture and preference and that kind of thing. Maybe some of the vehicles are just smoother. But as far as protection, if you ever look at one of the surveys on that, I mean, sometimes the best one is like, the CVS off brand in terms of the benefits. No, it isn't really about the brand.
Okay. Now, when someone's out there for an extended period of time, so from, let's say someone's out there all afternoon from noon until 5 o'clock, could be, where you grew up on a farm area. How often should they reapply sunscreen?
Yeah, so here's another pitfall. So if you look at the back of any of the products on the market, they will say that you need to reapply it every 80 minutes. So again, that's a rare thing.
Right.
So most people use a number probably that's inadequate and they don't reapply it. So they're not getting as much benefit as they think they are. It's kind of a false sense of security. So that's why we look at sunscreen as what I would call the last line of defense. Hats and sun protective clothing. You don't have to worry about reapplication, right? You're good for as long as you got it on. You've also got an SPF of at least, probably in most cases, 50. So you've got a nice SPF, you've got good coverage, and then for the skin that's still exposed, that's really where we lean on the sunscreen.
Yeah, I was thinking that, holy cow, because I teach a lot of times 3-hour blocks, sometimes 4-hour blocks, from 9 to 1 or 9 to 12:30, and I've put the sunscreen on. Is there a, I've heard this, I don't know if it's true. You're supposed to put it on at least 30 minutes before you get in the sun, or does it matter as long as you have it
Yeah,
on before you get there?
yeah. Ideally, again, you would apply it, and then just comes back to the clinical trials of how they did it. Yeah, so just to get the full benefit here, but you can see how the way it was done just doesn't really a fit for most people's real life experience. So that's where, trying to use a little higher number, trying to remind people using, the hats and the sun protective clothing is
Mhm.
as a more of a solid foundation. And then, do the best you can with the sunscreen, but you're probably not going to get it done as well as you think you are.
There's probably a woman right now saying, "Well, in my makeup, it says that there's skin protectant SPF for part of my makeup." Should women rely on that? I mean, you and I don't use that stuff, but what do you know about that?
Uh, so the ladies, yes, it's a great thing actually, and most of them have 15 or 30 in there, either moisturizer, foundation, or combinations of both. And that's actually a great thing because, especially where we live, a lot of the, 2/3, well, maybe a third of the year, it's cloudy and cold, and you don't think about UV protection, but there's still UV getting through even on those days. So, yeah, they're actually obviously in a lot of parts of life they're better than we are, Rob. Right? So there would be one example.
Yeah,
I also tell the ladies, and here's just another motivator for them more than probably for you and me, that the best anti-aging product on the market today is called sunscreen because it's the photo damage that ages the skin. So if you can protect against that, that's a lot better than spending hundreds and hundreds of dollars of anti-aging creams on the other side if you can.
right. And again, do it early. Now, I was asking my next question written down was you just said that it doesn't matter if it's winter or overcast or cloudy, that we're still getting UV because people are probably saying there's no way in the world I'm getting sun damage in New York City when it's 12 degrees. But you say yes,
Yeah.
you do.
You do. I mean, it's not as much as it would be here in July. I mean, it's probably if you look at like January in Northeast Ohio, still about 80% of the UV penetrates. And the other reality is, the ozone layer is not as effective as it was 30 years ago. It's gotten thinner, and so more UV is penetrating than did probably when you and I were growing up. And the UV that penetrates is actually more dangerous too. I mean, that's why we're in a skin cancer epidemic right now.
That's very logical. Yeah, it's kind of like the peanut allergy. I knew nobody that had that when we were kids. Now it
Sure.
seems like 3 out of 4 kids have those, nut allergies and things like that.
Right.
So, okay, when they talk about from, I think I heard a doctor say from October to March, especially north of the Mason Dixon line, that we should supplement with vitamin D because we don't get out, don't get as much sunshine. So, if vitamin D is good for us that we gain from the sun, correct?
Yes.
Okay. How much too good of too much of a good thing?
Yeah. So here's where the dermatologist will be the outlier. So primary care, especially, will be the ones. And again, I'm not exactly arguing against what they say, but I think we've got a different view on it a little bit anyway. So, do we all need vitamin D? Clearly. Is there a dearth of that where I live? No doubt about it. I mean, are women having trouble with osteoporosis and building bone and all those things? Without a doubt. Okay. Here's where we differ. Am I arguing we don't need vitamin D? No. What we're saying is let's get vitamin D, let's supplement, and the supplement, most people would argue that 2,000 international units a day as a supplement is a very reasonable amount. You're still going to get some more in addition to that with, dairy products and such. And you're also going to get some from what we'll call incidental sunshine, Rob, meaning that, you're running errands around town, you're in and out of you walk to the mailbox, that kind of thing where you're out a little bit every day. Where we differ is, they'll tell the patient to go out and intentionally get at least 20 minutes every day. Well, we're in the middle of a skin cancer epidemic. I mean, I'm saying I think you can get your vitamin D in more, other ways versus trying to get intentional UV in the backyard.
Okay. So you gotta be careful then.
Yeah, I mean, there's a balance here, right? I mean, as I always tell my patients that when I have their closest attention is when I've just cut off their first skin cancer. I have their undivided attention at this point, and the guy will say, "Do I need to sell the boat? Do I need to give away the convertible? Do I need to, throw the golf clubs in the side?" No. So all we're saying is we got to protect you while you're doing the things you like.
Mm.
We just got to use good judgment. We're not trying to change your life radically. We just have to make reasonable, common sense adjustments here.
When I have a rainy day here in Atlanta, I wake up, everything's wet, it rains. I will run a couple errands and never put on sunscreen. I mean, it could be raining the whole day. At the end of the day, my face feels hot. So I've gotten some UV stuff without sunscreen on, even for the less than 10 minutes of outdoor exposure.
Yeah, I mean, where you guys are obviously more intense than us, and that's just verification, right? That
Hmm.
even though it doesn't seem like it, you're still getting a fair amount of UV, especially in those warmer months where you guys are.
Yeah. What's it mean when when somebody this happened to us when we were kids? You get burned and then you peel. You don't ever want that, right?
No, no. In fact, what we think, I'm going to tie this to melanoma, Rob. So, what we know about melanoma is it seems to be related to what they call intense exposures, especially early in life. So, it's that sunburn, where we live right now. So, today was a day like this. So, it's March, it was 70 degrees. Everybody has cabin fever. You want to get out on a nice day, but of course, you overdo it and you get a burn. If you have multiple of those, and the data would say more than 5 or 6 before age 18, your melanoma risk goes up. So we got to be careful about the intense exposures as well as the day to day exposures.
Mhm. Are you familiar with seasonal affective disorder?
Yes,
Okay, which is lack of sunshine. I kid around and I'm also serious at the same time. Has nothing to do with not making money because it rains all day, but to me, I get down on rainy days because I don't get to encourage and motivate and interact with people. But I don't care if I was at the nicest club in Connecticut or wherever. I need some sunshine to feel happy. I don't know how they do it. I heard that they put like extra lighting in the offices in Seattle. I don't know if that's true. So do you see that in your field? And it's like, what's your recommendation? It's like, okay, you can go get X amount of sun, but you still need to protect yourself, or what do you experience? What's your
yeah. So I think yeah. So there's a certain group of people that are probably a little bit more sensitive to that lack of sunlight than others as a group out there. But here's an interesting fact to that, Rub. So that the treatment for it is actually visual light. It's not UV.
Hmm,
So these SAD lights that they sell, it's visual spectrum light. And what I mean by that is it's not ultraviolet light. You don't have to get to a tanning bed to overcome this. We'd rather treat the problem. Not saying it's not legit because it is, but we don't want to create danger on top of the treatment. So the visual light is the therapy there.
okay. So was it 21 hours of darkness they get up in Alaska? That's why
Can you imagine?
my wife has a cousin that lives in Anchorage, and he said, when I first met him, he said that, he talked about all the days that it was, 40 below and so forth, just nuts. But he said, you either go to Barnes and Noble, the coffee shop, or the bar at the end of the day. And he said, hence there's a lot of alcoholism because, you're just in your office or whatever, and it's just dark. And he said, you go to a bookstore or wherever where there's a lot of light and you feel
Sure.
better. So
Yeah. No doubt.
I'll live vicariously. I don't really want to experience it ever. um, are any of our skin care or skin issues related to diet?
Yeah, so you think about so just basic good health, right? You have to have enough protein to make skin, hair, and nails. So, people that don't have those sort of balances in their life, will not have healthy skin, right? Just that the collagen synthesis isn't going to be there. All those kind of things. Vitamin C is important for these things as well. Um, Iron is important for these things. So there's a lot. Yeah, diet is definitely a critical part of the whole body function, obviously.
Now, do you guys, I don't know, maybe just too general. Like when someone's got skin cancer, do you say, hey, you need to start eating XYZ?
Yeah, no, it's really not connected to that. It's in most cases it's just purely sun damage over usually an extended period of time, and there's some other factors at play, but predominantly it's going to be excessive sun over long periods.
Yeah. Do you guys ever question the patient about a high sugar diet?
I mean, probably not in the realm of the skin cancer part of it, but when you look at things like inflammatory skin disease, so like let's just take psoriasis as an example. In that case, there are dietary approaches if you're able to reduce inflammation within the system, and a lot of that's driven by sugar, as you alluded to. You actually can improve skin disease like that, and even joint disease with dietary change. Yeah,
Mhm.
so there's definitely a role there. Yeah, I actually I have a group of books that I give out. It's an old book. Maybe you've read it somewhere. It's probably 30 years old. It's a book called Eat to Live,
Mhm.
and that's the premise of that book. It's all about anti-inflammatory diets for lots of body conditions.
Is that the one Jesse Itzler talks about that only eat fruit until noon? Was it the same guy?
I don't think I don't know if it's the same guy or not. I mean, one of the things, if you ever pick this book up, when you read through it, you'll just say, this is common sense. Like, there's nothing here that's radical or, sort of fringy at all. It's just like
Yeah.
whole grains, it's fruits and vegetables, it's
Right.
fluids, it's
Yeah.
avoid high sugar things, like avoid, saturated fats. Like, there's nothing radical there, but I don't think a lot of people still eat that way.
Yeah. Yeah, just the John Wooden school of moderation, right?
Yeah. Yeah. I mean, just basic fundamental things. Doesn't mean you can't ever have a cookie or anything like that, but just you got to change the basic day to day approach.
Hmm. How much is skin cancer hereditary?
So I guess I'd answer it like this. So melanoma can be genetic. So if you look and say, well, my dad had melanoma, his dad had melanoma, my aunt had melanoma, I mean, your risk is going to be elevated based on the genetics in that case. For most skin cancer, it's more related to skin type. If your mom and dad are blondes, I mean, you're probably blonde, right? And so your risk factor is going to be your paleness, if you want to say it like that.
Okay. There was a lady I used to teach, and she had an identical twin sister, and they were mirrored twins. One was a righty, one was a lefty. And I'm not sure which leg it was, but on the outside of one of the lady's legs, she had skin cancer, and then the other twin had it on the opposite leg, like they might have been in the womb together, and it's like, they took it like a badge of honor that, "Oh, yeah, we even had skin cancer in the same place, but opposite legs." So, that led me to the thought about it, being
Yeah,
hereditary,
that's a great question. I see things like that, and you ask me, how does that happen? I don't have a great answer for you.
right?
That's interesting.
Yeah.
Yeah.
Okay, this is, pertaining to lip care when we go out in the sun. Are those little in the stores where you see all the sun care, those little lip things actually what you're supposed to be putting on your lips, or do you recommend something else?
So the lip balms with SPF.
Yeah.
Yeah. No, I do. I think it's just, again, if you look at data on like sunscreen application, 60% of people forget to put it on their ears. I can't tell you how many surgeries I've done on ears over the years. And I think the lips is another neglected area. And the lips, just another thing about the lips. If you get it, especially a squamous cell cancer on the lower lip, it's the most aggressive place to have a squamous cell on your skin anywhere. So it's a big danger. So anything you can do with products like that to protect your lips, definitely a good idea.
What's something like that look like? Or do they look differently?
Now you really can't visualize it. I mean, I think the good products, they go on pretty clear now. So I don't think it would be something that would stand out much.
No, 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 I meant this would you say squamous cell? What
The cancer,
Yeah,
yeah, it's like a painful sore
okay,
in most people.
okay. So people would know it's like cold sores and things like that would appear, or
Yeah, and it bleeds, it hurts, it
Yeah,
gets bigger, it doesn't go away. It would be pretty clear. Yeah.
yeah, yeah. Can animals get skin cancer?
Yes.
Really?
Yes. It's funny. I have some patients that are veterinarians, and we'll talk about, one guy used to tell me that horses get melanomas all the time, but they usually don't die from it. And I said, I know nothing about this. That's just fascinating to me. So,
Well, it's
so
outside all the time. What are you gonna do, right?
yeah, it's true. When I was at the University of Florida, we actually used to have a combined conference with the veterinary students sometimes, and they would bring in a Labrador retriever that had cutaneous lupus in the skin on a dog. And we would look at, how it showed itself on the dog, and we would know how it would show itself on a human. And it was really interesting how they overlapped.
Mhm. That's wild. Yeah, because I sent you a picture one time of this. It took the space of one of our restaurants nearby. It's an animal dermatology office. And I texted you, I go, "Is this real?" I didn't know
Eh,
you know, there was a need for all that.
yeah, I don't think there's one within 500 miles of me, quite honestly, but I think that's because of UF down there. Yeah.
Okay. Wow. See, everybody's learning from you today, Doc. Very cool.
Good stuff.
Well, okay, this is coming from a guy. I hear this all the time. So and so just got Botox. They won't be at the lesson or, whatever. They look like they just got Botox. What the heck is Botox?
So Botox is short for botulinum toxin, okay? Which is also why they don't want to advertise it quite like that, because I think if people really knew exactly what was going on, they probably wouldn't use it as much. But yeah, obviously in dermatology, it's mostly used in the cosmetic world and, crow's feet around the eyes, forehead wrinkles, all that stuff. And so it's been around a long, long time. But essentially, the way it works is it's injected into the muscles to create a paralysis so the muscles don't contract, and that's the way it works,
Which means there wouldn't be wrinkles because the skin is
because the
stiffer?
muscle can't move. Like, if you ever see somebody that's had a lot of Botox, especially in their forehead, they can't raise their eyebrows,
Wow.
and it can look even, in some cases, very, very odd that, you don't have natural expression because you almost look like a mask face sometimes if they use too much. Now, the good thing, and maybe it's the good and the bad, is the effect of it probably lasts on average about 90 days. So, you know, y- if you hate it, it's going to go away. But if you love it, I guess the negative is you got to do it again. So it's something that a lot of people were doing, of course.
So that wears off, and that's why they have, "I got some more Botox." You hear that?
Yeah. Yeah. They schedule it, probably most people every once a quarter. They go and get touched up or do whatever they do. But yeah, a lot of people that are in that pattern, they continue forward.
Now, is that something you advise against?
No, I don't advise against it. It's just not something that I've really ever gotten involved in. I'm not really interested in the cosmetic side
Oh.
of dermatology. So leave that to the people who like doing that kind of stuff. I'm a what I would call a meat and potatoes dermatologist. I like medical dermatology, surgical dermatology. I'm not a cosmetic dermatology person.
Yeah. Now what are fillers?
Yeah, so these are products that basically you would inject in wrinkles on the face, like the wrinkles like here rub, like in this location on the cheek or maybe down here, basically to fill in that crevice to raise it up so it isn't as pronounced. And so those they inject in there, and there's a bunch of products out there, probably more than I could name for you, but those longer than Botox, probably 6 to 9 months in some cases, and then the body kind of degrades them. There's some that are longer lasting than that now, but
Yeah.
again, they're just cosmetic products.
When, someone comes into you, can you spot somebody that's done a lot of Botox to your professional eye?
Yeah, you can see it. Again, it just depends, and some people who maybe haven't gone crazy with it. They use it in a more subtle way. Maybe it's not as obvious, but of course there are people out there that you can tell that they're want a dramatic effect for whatever the reasons are. So it can be.
Are those things dangerous at all?
Well, I think anything, in the wrong hands, if you put those products in the wrong locations, you can have complications. Sure, you can paralyze muscles that you don't want to paralyze. You can make the eyelid droop for 3 months. You can hit an artery when you inject that stuff and get into trouble. I mean, by and large, people do well and they're pretty safe things. But again, there's always a small risk in things like that.
Mhm. Yeah. I get it. I mean, nobody wants to see wrinkles and all that stuff, and, what about I mean, I guess it's a drastic measure, a facelift? Is that long-term detrimental to the skin or
No, it really isn't. That's the plastic surgeon world there, where they'll basically grab a hold of some of that tissue underneath and just pull everything tighter. And yeah, it's more of a permanent type situation. But probably people who do that also do all the other things too.
Oh, okay. Yeah,
They'll probably do that. They'll probably do Botox. They'll probably do chemical peels. They'll probably do
yeah.
fillers here and there. They'll probably do who knows what. Same goal.
Okay, I don't know any guys have done this, but, what's with the lips when ladies get their what are they doing? They're making their lips bigger? What is all that?
Yeah. So those are fillers too.
Okay.
So yeah, this is Angelina Jolie type of thing. They just Kardashians, that kind of thing. They just like this look of a fuller.
Okay.
lip, because one of the things that happens with aging is that the lips actually do kind of lose volume, and so they're just trying to make up for some of that. But some people go overboard, of course.
Right. Okay. Why do I guess when people get older and you could ask somebody in their 80s, "Are you okay? Is that a bruise?" And they'll say, "No, that's just an age spot." What is an age spot? Is it normal?
Yeah, we see lots of different age spots, but most of them are these kind of crusty brown spots that really can start happening even after you're about 35. So we just accumulate with years, and these little red spots that you see on your skin, they're called angiomas, pretty much universal. Everybody gets those little things over time as well.
Mhm.
And then people who get up into the 70s, 80s, and such like that, when you look at their forearms and hands, you often see bruises that are there that because the skin just gets more and more fragile. The most minor bump, will create a bruise that'll be there for 10 days.
Mhm. You mentioned angioma, a lot of little kids have those early on, right? Like babies.
So that's different. Those are called strawberry hemangiomas. Yeah, those are a little different thing, but basically they're both made out of blood vessels. That's the similarity.
Our daughter had one on her nose, and the insurance company said it was surgery because they used a metal object to get rid of it. It was anyway, but I think they called it a cherry angioma at the time.
Okay.
But yeah.
Mhm.
Anyway, what's your feeling on tanning beds? I kind of suspect what you're going to say, but
Don't ever go into one. How's that, Rob?
how's that?
Don't ever go into one.
Talk.
That's a universal statement, right? So
Okay.
it's another soapbox topic, right? So I'll just give you a couple things on this. So 20 minutes in the tanning bed is equal to 5 hours of outdoor sunshine.
Unprotected.
Yeah. So it's the idea that the intensity there is significant, right? And anybody who's ever gone to the tanning bed place, they'll get you in there 20 minutes per session pretty quickly. So it's just a more accelerated, skin aging process, and it also raises cancer risk. So there's nothing redeeming there,
Okay.
really not.
Yeah. So we're in the spring prom season, just cranking up down here, and
Yeah,
you hear high school kids and college kids and going to the tanning bed because they got the prom, or people talk about weddings and they're doing all that.
yeah,
An absolute no. Okay.
absolute no.
Now
Yeah,
I don't know what this entails, but what are spray tans?
spray tans are basically they're just a dye. It's just a superficial dye that gets sprayed on the skin, and then usually within about 10 days, in most cases, they'll just peel up. But they're not dangerous things. Yeah, they're I guess they would be a reasonable alternative to going and getting a natural tan.
Mhm. What about these, what are they called? These tanning lotions, like darken your skin, and is that just a topical thing too? There's no danger in those?
Yeah, it's just a topical, just a dye. It's kind of like the spray tan idea, except it's in a bottle. You can do it at
Okay.
home.
Okay. Yeah, I take off my socks. It looks like I'm still wearing socks. So I get reminded by my kids every year I jump off the diving board. So there's something else I was going to ask you, maybe about tanning beds, but those are definite no-nos. So sunscreen every day if you're going to be outside, huh?
Ideally, yeah, especially with for what you do, Rob, no doubt.
Yeah.
Yep.
And then if you see something, like discoloration, does that usually go away? Like, it's funny you said that about ears because the first year that I taught full time, I never put sunscreen in my ears. And then I was like, oh my gosh, it was hard and crusty. And I don't know if that was dead skin, but that's the first place I put it on.
Yeah. So here's what I tell the patient. If you said, okay, well, what are you giving me all this information? All right, I'm going home. Give me just a real quick thing. What am I looking for when I'm doing my own exam? So I try to get patients about once a month to do a self exam, and three things I tell them to look for. So things that turn black, because that's how melanoma can present. The second thing is things that don't heal. And the last thing is things that grow fast. So if I can get them to just once a month look at themselves head to toe and try to get their spouse to help them with their back and be aware of these three things, try to protect the best they can. I think that's the basic instruction that I give to people every day.
So just keep an eye on that. Like if you see something then.
Yeah, that way, if you say, and this fits the bill of what you just said, or I always tell them too, if there's just something you just don't like, I mean, you're worried about it, you don't know what it is, let's look at it. I'm going to look at it. And if there's a doubt in my mind, we're just going to take it off and let pathology tell us.
Mhm.
So we'll take no chances.
Yeah. How often do you recommend people go see a dermatologist?
Yeah, I think it depends a little bit. So if you've been a healthy person, you don't have any personal history or family history of skin cancer. Maybe if you're, where you live, probably wouldn't be a bad idea to be, late 20s or 30 just to have a baseline look is a good idea. And then, if everything's good, maybe every 1 to 2 years is good. If you've had cancer, then the risk of another one is higher. I mean, I've got people I see every 3 months, just depending on their risk factor.
Mhm. Okay. So if it turns black, it doesn't heal and grow fast. Okay.
Hmm.
Awesome. That's a great way to wrap up some good common advice. So wear your sunscreen, and 15 is really 5, so you should probably a minimum of 30 to 45, 50.
Yeah, I think so. I mean, it would also tell you that, 8 and 4 are basically hand cream, I mean, don't waste your money on stuff like that.
Yeah. Okay. All right, just make sure that the spray stuff does cover the body.
Yep.
Yeah, it's funny that when I tried that one time and I felt like it was tacky on me, and I just didn't like the
Hmm.
feeling, and it's like it's easier to apply because a lot of people don't want the stuff on their hands, but, I guess that's personal preference.
Yeah, without a doubt.
Well, we'll probably get some, questions and stuff in the, feedback here after the editing and so forth, but, I'll do some editing quickly and get this up for prom season so some of these kids don't go back to the tanning bed.
Yeah, that's great, Rob. That's public service right there. I mean, literally could be life saving. Quite honestly, I mean, I have people who have been at tanning bed lots of times. I've taken a lot of melanomas off younger women in that situation. I mean, it's an important public safety message.
Really. Just say no.
Yeah, and
Uh,
just say no.
Now, let me ask you, how come there's no okay, it seems like every ad that you see on TV, the FDA approves this message. And then, to me, the criminal side is look at the side effects. I'm thinking, well, I'd rather have that problem than deal with the side effects. But how come the FDA doesn't crack down on tanning bed or these tanning places?
Well, the short answer, honestly, Rob, is it's money. It's a really, really strong lobby.
Okay.
They got a lot of influence.
There you go. Well, we won't get too political. We'll try to keep this as
I mean, it would be a common sense thing. Like you got a known cancer causing agent
right.
that doesn't have any other redeeming quality. Like, why would you want the public to be subjected to that? Like, it doesn't make any sense. But
Yeah.
the world we live in, so
Yeah. So you're just allowing people to go in there and you're thinking you're coming out because, oh, this was easier than going outside.
yeah.
Yeah. When
I'm
you
going
say,
to tell you just a really quick story
yeah,
about this. So I had a patient of mine who owns a bunch of tanning beds in the area, and he was in my office. And as I'm cutting a skin cancer off of his shoulder, okay, literally while I'm doing the surgery, the guy says to me, there's really no evidence that tanning beds cause skin cancer. And I'm thinking to myself, do you hear yourself when you talk? Like, this is the most ironic situation I can think I've ever been in.
yeah,
Like, do you know why you're here? You use your product, you're here today. Isn't there an A and a B connection here somehow?
yeah.
It was illogical.
Wow. I'm picturing that one commercial now about if you need a tan, I'm your man. The guy stands up at the graduation thing.
Yeah.
Oh my
Right.
goodness.
Yeah.
Oh my goodness. That's crazy.
Yeah.
Except for that thing on your shoulder, everything's perfect, right?
Yeah. I mean, outside of this big scar you're going to have the rest of your life, you can think about this, I guess, but
Oh.
I- it is strange.
Now when someone okay, I forgot about this question. You mentioned that you've got somebody in there with skin cancer. Are they more susceptible to more skin cancer or could be just like a one-off?
No, they are. I mean, just real quick. So, you and I, with our skin type, would start life with about a 20% risk of a skin cancer. If you've had one, the risk going forward goes up to about 40%. You'd have a second one. If you've had two, The risk of a third one's about 60%. If you've had 3, it goes to 80. So it's a matter of when and not if,
Yeah.
once you've had 2 or 3.
Yeah. I got a buddy who's always wearing his hat now when we play tennis. He's very fair skinned, and they had some cutting on him last year. So that's
Yep.
interesting. Yeah. Well, all right, Doc, I appreciate your time. A couple things here to wrap up. You said the tan is the body's defense mechanism. It's not this glorified, bronze look we're supposed to have.
Yep. Mhm.
You talked about learning from Coach Fusco, the participatory dictatorship. That's what you called it.
That's what he called it. Yeah, that was our form of government, right?
Yeah.
Yeah.
Well, and I know I remember when you were probably second grade, you had all the presidents memorized and you had fun facts about them. And my dad sat there with his mouth open, and I thought, man, my buddy knows some things. But that goes to show me that I won't make you do it now. You talk about preparation, and that's something that I think everybody successful does. The pre-practice practice. That's part of the Westminster. Was that Dar Huey's philosophy?
Dar Huey's philosophy. Absolutely. Yep. And man, just the value over the last, I mean, since those days of however many years it's been, 40 years in my life, I mean, it's benefited me, no doubt.
Yeah. And stress level, everything else goes down when you're prepared.
Yeah, you've done the best you could do. I mean, there's a comfort in that, right?
Yeah, that is so great. So you're prepared for practice. I bet John Wooden would have loved that. Huh.
For sure.
But, it's
Yeah.
it's interesting that Joe Paterno would he would audit his words that he was going to say to kids. As I want to say the most impactful thing in as few as words possible. And Dar and I were talking one time about white hats on the ball. And so
Hmm.
when I'm looking at the game tape, I'm seeing white helmets on the ball. And the stories of John Wooden spending 3 hours to practice to prepare his 90-minute practice. It's all that preparation before you get to practice. That's You wonder why the great ones are great, huh?
Yeah.
Those
Yeah. And then there's an efficiency built into that too, right?
Yeah. And so you get them. How long were your practices at Westminster?
Yeah. About 2 hours, and we look back at one of the interesting things about a lot of our practices is they were mostly mental. We didn't actually hit a lot during the season. He wanted to, save that for Saturday. So he spent, Coach Nicholson, obviously a genius, Coach Huey, Coach Fusco, all those guys are just incredible teachers. They wanted us to, basically recognize formations, recognize tendencies, recognize, areas of weakness. So how are we going to respond if they did this? We were going to do this, and how, execution of the plan, and the, why are we running this defense in this situation? And so then sometimes you'd get there on Saturday, you'd know when you lined up, there were only 3 plays they ran out of this formation.
Hmm.
So I mean, gosh, your success rate goes way up where you don't have to think about,
Yeah.
most of the other possibilities.
Okay, you just gave me some insight into this because back in the early '90s, I went to see the Pirates play a playoff game, and I went by Westminster, said hello to Dar, and at practice they were out there, and he would go, and then you guys had pads on, or maybe you didn't even have pads, but they would do what you just did. So that was the formation of the offense, and then the defense would, like a dress rehearsal, so to speak.
Yeah. Yeah, and sometimes even, okay, so we know their tendencies are XYZ, and so, you know, because of that, the plays are most likely going to be this. And so, in addition to being prepared for it, you could disguise the defense in such a way, that the guy would throw the ball to the flat, but it didn't look like the corner was going to be there at the snap. But as soon as the ball snapped, he runs to the corner, he throws it right to him.
Yeah,
You know what I mean? Like,
yeah,
I remember we played down at Tarleton, Texas in the national playoffs in '89. And I remember, watching the quarterback's eyes as he comes up to the line of scrimmage, and he's absolutely baffled. He doesn't know what we're doing. He can't tell where the tendencies are, where the vulnerability of the defense is. And after the third interception, we're just in his head. They didn't cross the 50-yard line until the fourth quarter.
that's awesome. And so you're looking at your buddy giving him a week going, yeah, we're in his kitchen.
Yeah, you could just see the kid, like, he just doesn't know where to throw the ball. He's shook with every interception, it's just
Yeah,
he was just mentally beaten by halftime.
that's great. Get any big sacks in the national championship? Come around the outside edge?
No, I didn't actually, no, I did not get to, but, that's one of those games you'll never forget. That was the last football game I ever played in my life, was at the Hall of Fame Stadium in Canton in 1989. We won the national championship.
That's great. That's where you
So,
wow, that's awesome.
yeah,
That's a good way, man. Only
it's
only
a good way to end.
only one other way better to be to walk in with the jacket, huh?
That's right. Yeah, that's good.
All right, and I loved what you talked about that your parents that, no complaints, no excuses, finish what you started, how you were a kind person and nice to people. I love what you said about adversity. It's your gift as an athlete is to face adversity, and what we're so afraid of is facing adversity, but that's the only way you do grow. I thought that was a super quote from you.
Sure. Yeah. Adversity. Life is full of adversity, right? You're either in a trial or you're going to be in a trial, right? It's not really, it's the question how you going to react to that case.
Yeah. Was it Lou Holtz life's 10% of what you face and 90% how you react to it? Something.
How you react to it. Yeah.
Yeah.
I think that's probably Lou. Yeah. I mean,
Yeah.
yeah. What do you do now? You just had great success. What do you do now? You just had failure. What do you do now? You got to respond, right?
Yeah. Yeah. Everybody wants a perfect life, but it's all about growing.
Day to day, right?
Yeah. Man, I've had a great time talking to you, and I appreciate your insights from your dermatology perspective. And I know a lot of people are going to appreciate it too. So thank you for your time, Doc.
Oh, Rob, the pleasure's really been mine. This is just a chance for you and I to catch up and tell stories that
Yeah.
most people would not know that if you and I see each other in a year, it's just like we never missed a beat. I mean,
Yeah.
it's just one of those relationships that to me is a blessing. And the older I get, the more I appreciate it. There's
Yeah.
not a lot of people in my life that, the conversation can just be off for 6 months and pick right up where we left off.
Yeah.
So
Yeah.
I appreciate you.
No, I appreciate you, man. I love you like a brother. And I like to say skull, and we're going to have a good season next year. And maybe our text will be a little bit better instead of,
Yeah, I hope so too. Maybe Kyler Murray is our answer. We'll see.
I don't know, but yeah, it's like just one of the big rings before we die, right? So, no.
Just one is all we're
Yeah,
asking for.
yeah, and it's funny, last year, it's like, "Okay, week 6, I knew it was over. This hurts less than losing in the playoffs." So,
Yeah, that's true. I felt the same.
alright, I appreciate your time, Doc, and I'll let you know if when we get some questions when we get this up on the air.
Yeah.
So for you at home, if you like this episode, please send it, share it, like the other episodes that we posted, so share it with your friends. Until next time, make the most of your time, and always hang tough. Dude, that